I have a question about trust in big institutions and public health initiatives in general. The question is about masks. Early in the pandemic, as I recall, we were told that masks were not necessary. Then we were told they are necessary. And I think for a lot of people, that flip in messaging landed like a parent telling their teenage kid to always wear a seatbelt, but then you look into the front seat and mom and dad aren't wearing seatbelts. And as anyone who's been around teenagers or has been one, you make that mistake once, you're not making it again. And you may never recover from that particular example. In other words, the public felt like there was a switch of messaging. But what I don't recall happening was hey, we got that one wrong. So sorry. On us. You know what? The new data say blank. What I recall was a message of don't and then do. But there wasn't a lot of acknowledgement of how challenging the situation was. It was just a lot of top-down mandates. And in my opinion, and this is just my opinion, I think that led to a pretty rapid distrust of subsequent messages from which we still haven't really recovered. And so why do you think it's so challenging for public-facing officials to just say, look, doing the best we can at the moment, screwed up before, changing the message now, may change again. We're navigating this in real time. It's dynamic.
Yeah.
Please stay with us, because it goes without saying there's been a huge chasm around this and related issues.
Yeah, no, look, it's an important question. And look, I want to be thoughtful about how I comment on what was done in the first year of the pandemic. I was a citizen, I was outside government, and I don't know what was happening inside government in terms of the decisions that were made there. But I do know sometimes from my experience in Ebola and in Zika, during those experiences we had as a country, that in the fog of war, when everything's coming at you, sometimes it's hard to make the right decision all the time, right? So I want to give some of those folks who were there in the first year of the pandemic some benefit of the doubt. But I do think that the important thing, the principle I certainly try to follow, but one I think that, and we can all do better, I can do better certainly too, but I think an important principle for us in public health communication has to be that we're clear, that we're transparent about what we know and what we don't know, and that we explain the why to people. So if we're telling someone to do something, why? Is it because there's a lot of data behind it? Is it because it's a sort of expert agreement best practice? Because sometimes in medicine, sometimes when we don't have enough data to guide us on a therapeutic approach, but when the problem is imminent, then sometimes experts will get together and put together expert-informed guidelines to say, okay, look, based on our best judgment and the limited data we have, here's what we would recommend. And as the data evolves, we will change and modify those recommendations. We do that with hypertension, right? You evolve and update recommendations. We do that with lipids. Here too, I think that has to be like a key part of the approach. I think one of the challenges that I saw many public health officials encounter was even when they went out with comprehensive messages like that, which are hard to fit into a soundbite or into simple posts on social media, often a lot of that wasn't covered. What gets covered is the top line. This is what's being recommended. That's what's being required, et cetera. All the explanation is lost. It's missing, right? And I think we also are living in a time where people are reading headlines, like they're living busy lives, right? They're not necessarily always hearing all of the nuance that's being explained. But I think that's a challenge, right? It's like, I know many public officials struggled with how do you deliver nuanced information at a time when there isn't a clear black and white answer to things. But I think the last piece around this is, I think something I was taught early in medical school is to approach your patients with humility, recognizing that even though you have more training than they do, you aren't living their life. You don't necessarily know what they're going through, and you shouldn't assume things about them. And so approaching with humility means that you've got to recognize that not everyone's going to be able to follow your guidance. And if they aren't able to, that doesn't mean you criticize them. It also means recognizing that people may have ideas or suggestions for you that may actually improve your recommendations or how you communicate. And so these are the principles I think that are important in public communication. But I think that both the challenge of translating nuanced arguments into what's actually covered, that was tough for many public health officials. I think the other thing, honestly, just on a human level that became hard for many of them, and I am thinking particularly about local and state public health officials who are on the front lines that I talk to a lot, was they ended up getting attacked a lot and abused a lot during the pandemic. And I don't just mean attacked online, people showing up at their houses, people harassing their children, people threatening their safety. And this was often people who were upset about some of the requirements that were being put down from local departments of health. And you can understand, look, COVID was as stressful a time as we've seen recently. People lost their jobs, people were losing loved ones. Talk about a stressful time. But I think at a human level, public health officials who were exposed to that kind of abuse and who started to worry about their children's safety, many of them stepped out of the arena and said, is this really worth it to put my family at risk? And that was hard because we lost a lot of good public health people in that respect. I think in addition to having sort of these core principles of public health communication in place, I think what we also need to restore is an environment where we of frankly of humility and civility where we don't attack people who maybe have different views or are coming out with recommendations that are not palatable to us. And I think it's also incumbent upon our leaders in society to not stoke that kind of resentment and violence as well, because that happened during the pandemic as COVID got increasingly politicized. And while that may have been at times done for political reasons here or there, the people who suffered were both the public health leaders who were trying to do the right thing for their communities and the public themselves who weren't able to have a clear direct channel to and a dialogue with their public health officials because a lot of that ended up getting closed off.
Yeah, I feel like there was a lot of talking down to the dissenters in the general public.
Yeah.
And I totally agree that getting violent or harassing people with whom you disagree is totally inappropriate.
Andrew, the one thing just to say about the humility piece, and I'll give you an example here of where I think this could have and should have been done better, is in an effort, for example, around masks to recommend that people wear masks. And one important thing just to know is that when it comes to like schools requiring masks, like those are decisions that are made on local levels, right? The federal government doesn't mandate masks in schools. It doesn't have the authority to do that. So those are local decisions. But at the end of the day, there were people who did not want their children to wear masks, right? For a variety of reasons. Some worried about their social development. Some worried that it was adding stress to their kids. People had different reasons why they may or may not have wanted their children to wear masks. And one of the things I think that was not helpful was that when there were parents who made the decision they didn't want their kids to wear masks, I think some of them received a lot of criticism without people necessarily stopping to understand why they may have been making that decision. Because I'll say, as a parent whose children were in school, my kids are 5 and 7, and in the first year of the pandemic, they were doing preschool virtually, which was a nightmare. It was incredibly hard for us. Even when they got back to school in the fall of 2021, it was a really tough adjustment for them. And I could understand like some of the concerns that parents were having, wondering about, hey, how are these precautions affecting my child's experience and social development? So on the whole, the recommendation may still be, hey, improve ventilation in your classrooms, recommend masking, recommend testing, etc. But those recommendations, I think, have to be made in a way that acknowledges like the humanity of people who may have a different point of view or may make a different decision for their child. And I know that when localities made the decision in many cases to require schools and their kids in their district to wear a mask, that put some parents who didn't want that, they put them in a hard place, right? But I think that our failure to actually have an open, honest, respectful conversation about this, where we didn't feel like we were each being attacked as parents for our decisions or as community members for the decisions we were making, I think that not only hindered, I think, the response, but I think it actually contributed to this division, the sense of black and whiteness that, hey, it's us against them. And then suddenly, if I was against one measure, then I was against all of them. Or if I was for one measure, I was for all of them, because we just started segregating into sides. And this became a polarized experience at a time where really it should have been a crisis that brought us together, as messy as it was. And that, honestly, Andrew, is what I worry about most for the next pandemic, right? I think we've learned a lot from this pandemic about how to manufacture vaccines and how to develop them quickly, how to distribute them efficiently. And we had one it was one of the, I think, most historic and effective vaccine distribution efforts in this country, even though it certainly could have been better, but it was historic by all measures. We've learned a lot about how to do vaccines, therapeutics, a lot of the nuts and bolts of a pandemic response. But I worry what we are still struggling with is how we build trust, how we communicate with the public, and how we stay together as a country in the face of adversity. Because if we're divided the way we were during COVID, during the next pandemic or the next a threat that may come from a foreign adversary, that's a huge national security issue for us. And so that's what keeps me up at night when I think about the next pandemic that may come.
Two questions related to what you just said. First of all, as it relates to vaccines, in my opinion, and I think the opinion of many people out there, that the response to the next pandemic will be heavily contingent on at least some sort of acknowledgement that there are people who at least feel that there have been vaccine injuries, right? To simply say, okay, the previous round with COVID went this way, and now there's virus X, right? Let's hope not, God forbid, but sounds like it's coming at some point. And people are going to think to the last time, and they're going to immediately say, the last time we were told to take a vaccine, some people had a good experience with that, other people didn't. And in this empathy model of acknowledging and letting your moral compass guide and understanding the why behind what people are doing and how they're reacting, it seems to me that now would be the time to at least try and understand where they're coming from, even if one disagrees, maybe even especially if one disagrees, and try and get people aligned now before the next pandemic. And so what efforts are being made, if any, to try and acknowledge that some people really do feel as if they were harmed? I'm not saying if they were or not, but clearly there are people who feel that they or people they know were harmed. Is there an effort to present them with data, to have discussions with them, to try and get people aligned so that the next time around we can be more of a unified front, whatever the necessary response happens to be?
Yeah, no, it's a really important question. And to me, I always go back to first principles from practicing medicine, right? Which is if there is a medicine you give a patient, and even if it helps 99.99% of patients, but this one particular patient happened to be harmed by it, you go in, you acknowledge it, you talk about it, and you together chart out a path for how you want to move forward. And the path forward might be, yes, let's get rid of that medication, but let's use an alternative. Let's try it. Or we can't use that medication anymore. Here are the risks you may sustain, but we'll find other ways to protect you, right? That's what we would do in medicine, right? That's what I've done with patients over the years. I think here too, similarly, when it comes to tracking adverse events from vaccines, this is an area where the CDC and the FDA track and collaborate. And tracking means not only collecting reports from the public and from clinicians when they see an effect that may be related to a vaccine, but it also involves analyzing those to see were they correlated or where there's actual causation there, right? Because if today, for example, I felt unwell and I trace back what happened yesterday, and it turns out, hey, I ate this burrito that was out in the sun for way too long. The question is, am I feeling sick because of the burrito, or did the burrito just happen to be something that happened, but it's independent of how I'm feeling? Maybe it turns out somebody was actually sick with a GI bug around me, and that's the reason that I'm feeling the way I am today. The analysis that needs to be done on cases that are reported is important, and it's something that the CDC and the FDA do together. Now, that analysis, I think, is essential to communicate clearly to the public. And whenever I engage with folks in the public, which we do often, and people will talk to me about their experiences with vaccines, I do think it's important to acknowledge what people have gone through. Like some people, for example, like when I got vaccinated for COVID, for example, I felt like I had mild flu-like symptoms for a couple of days. It wasn't great. I would have preferred I didn't have those feelings. And then I felt better a couple of days later, and then I moved on. But I acknowledge it didn't feel good to feel that way. There are other people who may have had experiences where they felt that they had more serious side effects, and there may be a question, was that related to the vaccine or not? So I think we have to both hear and acknowledge those. I certainly try to do that. I think it's important to keep doing that across all of government. But I also think it's important for us to help people understand the process that we have to go through to understand whether those are related or not. If you go online and the CDC's site where they collect a lot of this information, and you just purely look at reports that are given of potential adverse effects, that you can't take that and say, those are all related to the vaccine. Look at this rate of harm. It's extraordinarily high, because we don't actually do that with any other vaccine or medicine, right?
Sure.
We start there, we do the analysis, and we try to understand what's actually related or not. So I think that's what we've got to do here too. One last thing I'll say is that it's important, I think, also for us to help put this in context of other vaccines and medicines and interventions that we use. So, for example, just take Tylenol, for example. Like most people think, oh, Tylenol, it's safe. There's nothing bad happens if you take Tylenol, etc. But people who track the data know that Tylenol, by and large, is generally speaking a safe medication. But there are people who experience adverse effects from Tylenol, liver damage, and other adverse effects. And that data is available. But what has happened in the case of that medication is that the risks and benefits are both analyzed, and then a recommendation is put forward about a generally safe way to use it. And then there's data put out about the side effects, common or rare, right? But I think sometimes we also forget that a lot of the medicines that we have come to take and just see as a normal part of our life, just like any other vaccine, like there's some rate of rare side effects that will happen. I say that because what I worry about in the black and white environment that we're living in is sometimes people will take an anecdote about a potential adverse effect and will portray that as the rule, right? And we'll say, look, I know somebody who had this side effect, so nobody should take this because this is what's going to happen to you. If we did that, nobody would ever take Tylenol. No one would ever take ibuprofen. No one would take NyQuil. No one would take any of the common medications that we pick up at the drugstore and that we commonly use. That's how I think we have to approach this, with a combination of clear communication, empathic listening, and data and context. Again, that doesn't fit neatly in a social media post per se, but I think part of what we need to do as a country is rebuild the relationship, honestly, between the medical and public health establishment and the public. And I think it starts with this kind of communication.